The intersection of folate and autoimmune disorders is a deeply compelling yet underexplored topic that sheds light on the subtle interplay between micronutrients and immune regulation. While folate is most commonly associated with fetal development, anemia prevention, and DNA synthesis, its role in shaping the immune landscape, particularly in the context of autoimmune diseases, deserves far more attention than it typically receives. The immune system, like the nervous and endocrine systems, operates on a foundation of finely tuned biochemical reactions, many of which are folate dependent. This makes vitamin B9 not just a passive participant in health, but a potential modulator of immune behavior, capable of either stabilizing or, when deficient, destabilizing the immune response. Autoimmune disorders such as rheumatoid arthritis, lupus, multiple sclerosis, and even inflammatory bowel disease are characterized by an immune system that is turned against its own tissues. One of the emerging insights from immunometabolism is that nutrients influence how immune cells behave, how they differentiate, how aggressively they react, and how long they persist in an activated state. Folate, through its role in one-carbon metabolism and methylation, directly contributes to the epigenetic regulation of immune cells, particularly T cells. These cells are central players in autoimmune reactions, and their identity and activity are partly determined by patterns of DNA methylation. Adequate folate ensures that the immune system has the biochemical tools to silence unnecessary or dangerous gene expression, potentially curbing the overactivation that defines autoimmune flare-ups. In diseases like rheumatoid arthritis, where chronic inflammation causes joint destruction and systemic fatigue, folate appears to be especially relevant, not only for its anti-inflammatory potential but also because of its critical interaction with methotrexate, a first-line drug used to suppress immune overactivity. Methotrexate inhibits dihydrofolate reductase, a key enzyme in the folate pathway, and its effectiveness depends in part on temporarily reducing folate activity in rapidly dividing immune cells. However, this comes at a cost. Patients frequently experience folate-related side effects such as mouth sores, gastrointestinal distress, and anemia. Supplementing with folinic acid or 5-MTHF, methylated folate, can often reduce these side effects without interfering with the immunosuppressive action of methotrexate. This practical clinical connection makes folate not just supportive, but integrally involved in autoimmune disease management. Beyond pharmaceutical interactions, folate has intrinsic properties that may help modulate the inflammatory milieu. In systemic autoimmune diseases, inflammation is often accompanied by oxidative stress, mitochondrial dysfunction, and elevated homocysteine levels, all of which folate is biochemically equipped to address. Folate's role in homocysteine metabolism is particularly important, as high homocysteine is not only a cardiovascular risk factor, but also a pro-inflammatory signal that exacerbates tissue damage in autoimmune disorders. By facilitating the conversion of homocysteine to methionine, folate helps buffer the inflammatory load and indirectly supports immune resolution mechanisms. There's also a growing appreciation for how folate might influence regulatory T cells, TREGs, the specialized immune cells that keep the immune response in check. TREGs are often functionally impaired in autoimmune diseases, leading to a breakdown in self-tolerance. Some studies suggest that folate enhances the expansion and function of these cells by supporting DNA synthesis and epigenetic maintenance. In effect, folate may help shift the immune system from a state of aggression to one of controlled surveillance, reducing the frequency or severity of autoimmune flares. Interestingly, folate deficiency has been observed in patients with various autoimmune conditions, whether due to poor diet, genetic polymorphisms like MTHFR mutations, medication interactions, or chronic inflammation impairing absorption. Yet, even when folate levels appear normal on lab tests, functional deficiency may persist at the tissue level, especially when systemic demand is elevated by ongoing immune activity. This hidden insufficiency could exacerbate autoimmune symptoms and make the body less responsive to anti-inflammatory therapies. Replenishing folate stores with bioavailable forms may help bridge this gap, especially when paired with other methylation-supporting nutrients like vitamin B12, choline, and betaine. Another underappreciated aspect is the gut-immune folate axis. Many autoimmune conditions are rooted in or exacerbated by gut dysbiosis, an imbalance in microbial populations that regulate immune tolerance. Certain gut bacteria actually synthesize folate or influence its absorption, while folate in turn supports the health of intestinal epithelial cells and the production of short-chain fatty acids. This bidirectional relationship suggests that optimizing folate intake may help restore gut immune harmony, particularly in autoimmune diseases with gastrointestinal involvement, like Crohn's disease or celiac disease. The potential for folate to support remission, reduce dependency on harsh immunosuppressive drugs, and protect against the collateral damage of inflammation is a deeply promising area of study. While it would be overly simplistic to say that folate alone can treat autoimmunity, it is increasingly clear that it helps build the cellular environment in which healing and immune recalibration can occur. It supports not just the structure of cells, but the code by which they operate, the genes they express, the pathways they activate, and the inflammatory signals they choose to amplify or suppress. In this light, vitamin B9 transcends its textbook role as a prenatal nutrient or anemia-preventing agent. It becomes a quiet architect of immune equilibrium, an invisible but essential contributor to the body's attempt to restore balance when its own defenses become disoriented. And in a therapeutic landscape often dominated by drugs that silence or suppress, folate offers a more nuanced, supportive approach, not to override the immune system, but to help it remember what healthy regulation looks like.